Hey there, healthcare pros. In today's video, I will cover the top 5 newborn health issues and how to handle them. Let's get into it. First up, we have jaundice. Jaundice is when a newborn's skin and eyes turn yellow due to high bilirubin levels. This can happen because newborns often have immature livers that can't process bilirubin effectively. There are 2 main types. Physiological jaundice, which appears around the 2nd or 3rd day of life and resolves within 1 to 2 weeks, and pathological jaundice, which can appear within the first 24 hours and might be due to underlying conditions like infections or enzyme deficiencies. As a nurse, you'll need to monitor bilirubin levels through blood tests, encourage frequent breastfeeding to help excrete bilirubin, and educate parents on signs of worsening jaundice. Administer phototherapy as prescribed and keep an eye out for signs of kernicterus. Next, hypoglycemia. This is when a newborn's blood sugar levels are abnormally low. It can occur due to factors like being born to a diabetic mother, prematurity, or stress during birth. For instance, infants of diabetic mothers might produce excess insulin, leading to low blood sugar after birth. Preterm infants, on the other hand, might have inadequate glycogen stores. Your role here includes performing regular blood glucose monitoring, ensuring early and frequent feedings, providing IV glucose if necessary, and observing for symptoms like jitteriness or poor feeding. Don't forget to educate the parents about the importance of regular feeding and monitoring. Third on the list is respiratory distress syndrome, or RDS. This is common in premature infants due to insufficient surfactant, a substance that keeps the alveoli in the lungs open. Preterm infants, especially those born before 37 weeks, and infants who experienced oxygen deprivation during birth are at higher risk. Nurses need to monitor respiratory rate, oxygen saturation, and signs of respiratory distress, administer supplemental oxygen or ventilatory support as needed, and provide exogenous surfactant if prescribed. Ensure a neutral thermal environment to prevent cold stress and educate parents about the condition. Moving on to infections, specifically neonatal sepsis. Newborns are vulnerable to infections due to their immature immune systems. These infections can be acquired during delivery or from the environment postnatally. Group B streptococcus, GBS, and hospital-acquired infections are common examples. Your tasks include performing routine screenings, administering antibiotics as prescribed, monitoring vital signs, practicing strict hand hygiene, and educating parents about infection prevention. Finally, neonatal abstinence syndrome, or NAS. This occurs in newborns exposed to addictive opiate drugs in the womb. Symptoms include tremors, irritability, and feeding difficulties. Infants born to mothers using opiates typically show symptoms within 72 hours after birth. Nurses should use scoring systems like the Finnegan Neonatal Abstinence Scoring System. Provide comfort measures like swaddling and rocking. Administer medications like morphine or methadone as prescribed, and monitor feeding and weight gain. Supporting and educating the parents is crucial here. In conclusion, early identification, monitoring, and management of these common health issues are vital for ensuring optimal outcomes for newborns. Nurses play a critical role in providing care and educating parents. Your comprehensive understanding and prompt interventions can significantly impact the health trajectory of these vulnerable patients. Thanks for watching. Don't forget to like, share, and subscribe for more healthcare insights.